It's official, private healthcare companies are scamming us in the US and the UK. As Assange said, the function of government is to take public money and to put it in private hands. And it don't matter if your health suffers or the whole world's health suffers. This will blow your mind. Hello there, you 5.8 million awakening wonders. Thank you for joining me on this voyage towards discernment where the light within can be cultivated. If consciousness precedes matter, then the purpose of life is to gain insights. If material precedes consciousness, then the purpose of life is to acquire objects and possessions. Why don't you discuss in the comments below whether you believe in a materialistic or idealistic model for the foundation and formulation of reality. But while we're pondering such large questions and while you're clicking on that notification bell to ensure that the algorithm isn't conning us blind, while you're subscribing to make sure we stand strong, let's discuss healthcare. We've just been through a global pandemic where many of you, I know because I read your comments, that's why it's so important that you comment, have been questioning the integrity of the government agencies that regulate health. In the United Kingdom, the country where I'm from, did you notice my accent? We are in the process of handing over our national healthcare systems to American healthcare firms that have been not proven in court to be fraudulent, but highly suspected of being fraudulent due to the nature of the payouts out of court they've been making to avoid court proceedings. We're going to be talking about that. We're going to be talking about how pharmaceutical companies literally sent pole dancers to doctors' offices to recommend drugs that are not good for their patients. You will not believe the farrago. You will not believe the circus that your healthcare, whether you're from the UK or the United States, you will not believe the lack of ethics behind medicine. This conversation with Dr. Bob Gill, family physician, GP, doctor and practitioner turned activist, has given us insight from the inside of our healthcare system. Whether it's the pandemic and some of the ideas behind it and some of the bad ideas, mandates and lockdowns that it led to, or whether it's the corruption at the heart of our healthcare system that involves big pharma, big medicine and big fraud, you are going to learn a lot. Stay to the end because you are going to be even brighter and even more beautiful by the end of this. Privatization is innately antithetical to healthcare. It's even in the word care is the suggestion that there should be a motivation beyond financial gain and profit. So what we're discussing really is a bill that's recently been passed in UK Parliament. The new Healthcare Act in the UK will turn the NHS into an American-style managed healthcare. Now, I know that some of the companies that are likely to purchase these new balkanized regions will be owned by, am I pronouncing it right, Centene, I believe, are one of the organisations that own one of the health insurance firms that are likely to end up running British healthcare. And I know that in America, I believe they're facing like a $1 billion bill for fraud exposure. So these healthcare firms that are going to be charged with running the UK's healthcare system in its increasingly privatised form have the way that they behaved in the United States is less than ideal. Am I right in saying, Bob?
Well, you're putting it very mildly, Russell. Centene is an American insurer, and it is now the biggest provider of primary care in the UK.
Wow, already?
Already. So it's not some threat of future takeover. It's happening right now. Other companies like Health Corporation of America, United Health, they have been charged with fraud, but what normally happens is they settle out of court. They never plead guilty, they're never found guilty. It's a cost of doing business. So if you make 10 billion in profit and you pay a fine of 1 billion, you're 9 billion, to the benefit. So
let me just check those facts. 10 minus 9. Right, yep, that's good,
yeah,
that's good.
So that is the system. Paying out and getting caught in fraud and paying out of court is part of that model.
I see. So this is one of the further risks of a for-profit healthcare model. Of course, the narrative that we're continually sold in this country is that the public sector cannot handle it. And a badly run public sector is, of course, appalling. But that denies the possibility that you could have new democratic healthcare systems where nurses, doctors, porters and patients could collaboratively be responsible for the manner of their healthcare, the way that it's administered and the way that it's controlled. Could that ever be possible, Doctor?
Well, it was possible. That's what we had before Margaret Thatcher came along at the end of the 70s. They set about doing this by stealth, in secrecy. The NHS was beautifully efficient. It had an overhead of around 4%. The American system by overhead, I mean administration, paying the CEOs, all the money being leached out of the system. In America, this is 36%. At the same time, we're told that the market can deliver efficiency. That is one of the biggest lies that has been successfully spun to pull the wool over our eyes. But the other important thing about private healthcare is it perverts the relationship between the doctor and the patient. So the doctor might start doing things that generate profit rather than that are in the interest of the patient.
Doctor, I'm going to say that you've used the words pervert there. Now, what do you mean exactly that it's going to pervert it?
Well,
do you mean like a pervert?
Well, I mean, my duty should be no other consideration but what is in the interest of the patient in front of me. I shouldn't be considering, am I getting a kickback from a drug company? Will I get a bonus if I do more expensive operations, for example?
How do you reckon that opioid crisis was facilitated? How do you reckon we ended up in a situation where addictive drugs were recommended to vulnerable people? Is it because of this kind of kickback, perverted system? And I'm going to use your word perverted there, Doc. I'm going to use it. Is it as a result of that?
Absolutely. You've got a very docile FDA. You have a company, Purdue Pharma, which spent money brainwashing and entertaining the doctors. In fact, they hired pole dancers as drug reps to go and entice these doctors into prescribing OxyContin. This is the level of the corrupting influence of private interests within healthcare.
Doctor, are you suggesting that there is something wrong with using pole dancers to sell OxyContin to vulnerable people?
Well, I would say yes, absolutely there is, because these drugs were given the clean bill of health by the FDA because they swallowed the line from Purdue to say these were not addictive. But these are an opiate-like drug. So, they had to do a very heavy brainwashing exercise to convince doctors to ignore their own judgment, ignore their own education, and start prescribing these deadly drugs.
Doc, during the global pandemic that we've just been through, although global pandemic is, of course, a tautology, we experienced unprecedented powers being granted to regulatory bodies, whether they were national or international, such as the WHO or some of the agencies in the United States. Is there anything in the relationships between big pharma and these regulatory bodies that should make ordinary citizens concerned? And what's your opinion as a professional physician about the way that lockdowns were mandated and in particular the way that vaccines were recommended and sometimes quite aggressively recommended? What are your views on that?
Well, in the UK and in America, all the focus is on pharmaceutical remedies to handle the pandemic. We ignored non-pharmaceutical remedies like improving people's health, taking basic steps like ventilating schools, for example. So all the solutions, funnily enough, had some profit angle to them. So that's why both countries did very badly, but very expensively failed in their pandemic response. The way the regulatory bodies work, particularly in the US, is that drug companies fund the FDA. Now, if that doesn't create a conflict of interest, I don't know what does. And if you look at the research on which clinical practice is based, this is sponsored by the drug companies. And they will only release favorable results. They will bury unfavorable results. And very often when new drugs are developed, they're compared to placebo rather than the best current treatment. So you're not getting a good comparison. Biased research, conflicts of interest, and a totally captured regulatory body.
Well, when giving out-of-court settlements to prevent your reputation being rightly tainted becomes a business model, allegedly, then surely we have to ask questions. How can we be handing more and more power to these healthcare companies, to these unelected globalist bodies like the WHO? Why are we sleepwalking into this disaster? Why are we trusting them? Let me know in the comments below what we can do to unify, to unite, to become solid against these forces that oppose our common and individual good. If you enjoyed this video between me and Dr. Bob, perhaps you'll be interested in supporting the kind of campaigns that we're developing to prevent this kind of thing happening at scale, to give us a voice to oppose the corporate forces that are determined to bring us down. If you enjoyed this video, have a look at either of these two, and please sign up to my mailing list right now so I can stay in direct contact with you. Look, I'll level with you. I'm not sure the algorithm's our friend. We're making these videos every day because we want you to see them. I need you to comment below because it's your conversation, your comments that drive this channel. Please, please, above all else, stay free. you.